Okay. Okay. Good evening, colleagues. Thank you for joining the COVID Champions webinar this evening with Dr. Modupe Ominaju, Consultant Public Health, Birmingham. Just the usual housekeeping. Please keep your mics on mute unless obviously you need to speak. Do use the chat box for questions or comments. The call is being recorded and will be shared with group members. And I've got the agenda in the group chat. I'll repost it again for colleagues that may be joining late. We'll have, obviously, then the intros. We'll have a quick recap on some of the unanswered questions from the previous meeting. We never had time to. Unfortunately, we can't answer all of them, but we'll answer the key ones. Then we've got a COVID update from Modupe, and then it's open Q&A from yourselves. Okay, so over to you, Modupe.
Thanks, Habib, and thank you to everyone for turning up this evening. Good evening to you all, and hope the week hasn't been too challenging. I'm sure lots of things are going on in all our different lives and areas of interest. First thing is to say thank you again to you all for all you're doing on the ground. You know, some of you send us regular emails, feedback, and it really does help us do what we do here in the public health team. And I think on behalf of Dr. Justin Varney and the entire team here, you know, we can only say thank you to you for your continuous support to your communities and for continuing to make the time to, you know, actively engage with us and to, more importantly, you know, lead within your various groups where you are associated across the city. We have mentioned, I think, the last time we spoke, that we are now in a state of enhanced support across the city. And what that means for us, as we know, is that there is more work that we're doing as a community to continue to reduce or stop the spread of COVID-19, in particular the Delta variant, which is now our most predominant or variant across the city. That variant actually now isn't necessarily termed a variant of concern anymore because it's now quite widespread. And so we continue to work with Public Health England and with all the key stakeholders in the NHS and others to ensure that testing, isolation, and vaccination, those three measures, are proactively enhanced across the city. As we know, Delta variant is more transmissible than other variants of COVID-19, and the evidence suggests that it's 2 times more transmissible. So when you're looking at the R rate and the rate at which people can spread the virus to others, the reproduction, it shows that when you have one person with COVID-19, when normally they would spread to perhaps 3 people, with the Delta variant, they could spread to up to 6 people. And we think that's why the cases are going up across the city. The other thing about this Delta variant is it tends to really affect the younger generation more with illness. Again, that's not what the other variant was doing or the other types of COVID-19, but this one seems to affect the younger generation. So these are the reasons why, you know, from our perspective, we just cannot stop. And I know that it's been a long haul for many of us. We've been doing this since last year, you know, looking at the trends and managing this, or we've come this far, and we're keen not to allow this virus to take over our lives for much longer. And that's why we have to do everything we can to keep testing. And we've been going around the city, dropping test kits off, as many of you would have perhaps seen, people on the ground, encouraging people to keep testing regardless of their vaccination. So even if you've had 2 vaccines, you still have to keep testing, because we know the current vaccines can protect you from illness and death, but may not necessarily stop you from developing the disease. And the evidence is suggesting actually after 2 doses of the Pfizer vaccine, you're protected up to about 96% protection you gain from that, from COVID-19. from the particular Delta variant. So that's really reassuring. And one of the things that we've also trying to do apart from testing and vaccination is support people who are told they have to isolate, because we've been getting a lot of feedback from yourselves and other people across the community who tell us that isolation is very difficult. I know I've had a text before from Test and Trace saying to me, you know, you've got to isolate. And so I'm keen to make sure that we can continue to support you all to continue to isolate when you're asked to. I'm just going to also go through now the actual figures we have for the current state of affairs with the virus. 1 minute. So our cases per 100,000, our case rate per 100,000 for the 7 days ending the 20th of June has gone up to 133.7 per 100,000. And when you look at the number of new cases, that's also gone up to 1,527 new cases reported during that period. Our rate of testing has reduced, so that had been going up, but is now reduced to 7,135 tests, both PCR and LFT tests undertaken in that week per 100,000. We also know that when we look at the positive tests out of all the tests undertaken, the proportion of those have gone up to 7.3%. However, when you look at the proportion of all tests, so both PCR and LFT that are positive, it's about 2.4%. But still, what we can see is these numbers have gone up. And so that tells us that more people are getting infected across the city. When we look at the hospital admissions, those have also increased. I think the last time we had a look, it was about 72 admissions across all of the hospitals. That has now increased to 97 admissions across the hospitals. And the admissions that actually we are also seeing, I think, include ITU admissions as far as we've been told by the NHS, but we continue to keep an eye on it. I know a lot of people have asked us how many of the people who are on admission have actually had their vaccines, and that information isn't necessarily coming to us directly, but we do know from national data. So we don't have it at city level here in Birmingham, but when we look at national data and what the reports have shown us nationally, those who are actually on admission in hospital tend not to be people who have had their 2 vaccines, which is really promising and reiterates the fact that the vaccines are working as we expect them to. We have had 1 death as well across the city. We've mentioned already that there are wards that we are most concerned about. You'd have received the newsletter this week with the ward maps that show you which wards have the highest case rates. And in addition to that, there are 15 wards across the city that we are managing much more closely. And these are wards where the vaccine uptake is low, the testing uptake is also low, and there are higher rates of infection of the disease. And when you look at the infection rates by age group, we can see that there is an inequality because the much younger generation, like I mentioned earlier, and that perhaps is a reflection of the actual variant, the much younger generation are most affected now. So the 20 to 39-year-olds have the highest case rates across the city. They have a case rate of about 211.6 per 100,000, followed by the 0 to 19-year-olds. And then you then have 40 to 59, 60 to 79, and then the 80 plus, their case rates have remained the same week on week now. I think the last 2 or 3 weeks compared to others who have whose case rates have gone up. So there's only so much I think we can do in terms of trying to look at the data. From our perspective, is trying to understand what more we can do to support everyone across the community, regardless of their age, and where they live. Because for us, we have to make sure that people across the whole city feel safe and can go about life as normal as possible under the circumstances. When you also look at the ethnic groups, as you've all probably seen in the newsletter, again, there are more cases in certain ethnic groups. And this time around, we know that, for example, amongst our white population, there are case rates there that are about, I'm trying to find that data. Yeah, okay. The case rates amongst our white group went up by about 66%. And so we see about 66% of the cases, within the white population, compared to 44% in mixed other groups and 32% amongst the Black population. Now, the problem we have is that we don't know how much testing occurs across the different ethnic groups. So that can oftentimes skew the data, and we don't often get an accurate picture necessarily about how it's spreading and which populations are most affected. But just looking at the figures, you can see that it's not the same across the different ethnic groups either. And vaccine uptake still varies quite largely across the city, but we have done a lot more. We have done a lot more, a lot better than we did before when it comes to people feeling more confident to take the vaccine. And I think that's partly because of, perhaps largely actually, because of some of the work you're doing on the ground, encouraging people and those who have taking part in various events in your local areas, the mobile vaccine van coming into your communities, feeding back to us about what's working well and what isn't. There have been examples of people in our vaccine toolkit who are champions, who have talked about the safety of the vaccines, and and I think all those things are reassuring people more and more. And we've also been told that there's some people who were a bit hesitant or wanted at the beginning of the vaccination program to see how it would go. I think as time is going on now, we're in June, at the end of June, more people are feeling more confident. That's what a lot of the research is telling us now. And many feel like they're now ready to take the vaccine. And that's why we're making sure that we can offer more access. And by working with the NHS, we are taking the vans out into the community and offering vaccination to as many people as possible. So I think in terms of an update from us, those are the key themes that are coming out. And I think just to sort of round up before we go out and look at some of the questions you've been asking us, it's to continue to remind everybody that we are still in a pandemic. Hand, face, space, good ventilation, testing, vaccination, isolation, all of those things that have now become a normal part of our lives do have to continue. And it's not where we thought we would be this week, because 21st of June, Monday, was when we were meant to come out of the lockdown, but we are where we are. And I think for us as a city, we are determined to work together to come out of this enhanced support, just as areas in the Northwest did, and make sure that we can hopefully get many people vaccinated and protected from COVID-19. Thank you.
Okay, Modupe, there's a couple of questions in the group chat. We'll do the LFT ones first. First one is, how reliable is the LFT test? Because there's rumors out there that it could be 80% unreliable, and champions need to know how reliable it is so they can bust myths if it is a myth. And then also, how are schools and colleges monitoring students doing LFT? You're on mute. Modupe, you're on mute.
Thank you. Sorry about that. I was saying I'll go with the easier part of the question first, which is the second half of the question. So schools are trying very hard to monitor testing. I think oftentimes they will, so the secondary school children are the ones who are currently testing twice a week, and primary school children do not necessarily test, but their households are expected to test. And where there have been outbreaks, and we've been able to go in with PHE to offer additional testing in even primary schools, we will test the children. So we're still following the PHE advice on that. We recognize that head teachers sometimes do struggle, and schools generally struggle to monitor how well the children are testing at home, because some don't fill in the forms online. And so many of the head teachers have been encouraged to write to families, and we have drafted some letters. It's a very difficult thing to monitor. And I think what we're hoping that by this point that parents will be doing is supporting schools to remain open. And the one way to do that is regular testing, because if we are testing regularly and we make sure that children are not sent to school who have COVID symptoms or who have tested positive for COVID, then we can stop it spreading. And I know that it can be extremely difficult. We get this with norovirus as well. And, you know, in the winter season, when children are told not to be brought to, when parents are told not to bring their children to school if they've had vomiting, to keep them at home for 72 hours, we know even then it can be very difficult. So it's not an easy thing to monitor. I think it relies on individual and family sort of level community responsibility. And where we've seen huge outbreaks in schools, it's always been largely because children with symptoms or children who have tested positive on LFT have been sent to school. And I think we are trying as much as possible to share that learning with families and encourage people to please, you know, take the responsibility and do the test. When it comes to how reliable the LFT test is, I think there have been mixed messages about this test. The reality is it's shown to work well in not just the UK, but many parts of the Far East where they've managed to get on top of this virus. They used this lateral flow test religiously. And one thing we know is the ability for the test itself to detect COVID-19, so what they call the sensitivity, has been shown to be about 70% as efficacious or as effective as you would have with PCR tests. So if a PCR test is able to pick up COVID-19, they reckon that an LFT test will be just 70% as effective. So if you've got 10 positive PCR tests, if you did those tests with an LFT, 7 out of 10 of them would be positive on LFT as well. Now, again, these tend to be based on studies that are usually done over a period of time, and those can change. And more recently, actually, we've been told that has improved even more. We do know that the LFT test is very effective when people have a high viral load, which tends to be when they are most likely to be even spreading the virus more. And so that's why it's encouraged that it's taken regularly. So it's not the sort of test that you do once a month. You know, if you do it twice a week, then the sensitivity improves and its ability to pick up people with the potential to spread COVID increases quite a lot. So that's the thinking behind it. And, you know, it's been tried and tested. We've seen it work in care homes, in schools and other environments. And I think using it in addition with vaccination and all these other measures has been shown to be effective.
Okay.
The other thing just to say about LFT, actually, before we move on to the next one, is that one of the reasons why LFT is also very beneficial is it's a rapid test. So unlike the PCR that will go to the lab, by the time it's gone to the lab and come back, you know, it could be days and this person with COVID is just spreading it. I think it's a good way of turning around results very quickly. So it's a win-win to use those tests.
Okay, so next couple of questions, Modupe. Is anything being done about the high rates in student areas? Obviously, end of term, lots of student parties happening. And then the second question is, the Delta variant symptoms are different to the previous Alpha and Beta symptoms. so are cases being missed, or are symptoms being presented later rather than earlier?
Yeah, so we have been doing a lot of work with the universities. Even this week, we've had meetings and we've written to them to clarify the guidance and to ensure that they can continue to support the students. I think many students we've been told, are already heading back home, but there are those who remain either on campus or on their private accommodation, and that can be, I think, very difficult sometimes. There's been football on, and we know that tends to bring people together in groups indoors. We've tried to target a lot of the student community with additional support around contact tracing and advice on isolation. And yeah, I think it's down to, like I mentioned earlier, the individual responsibility. And some of the universities have gone over and above and used some initiatives to try and engage more with students and encourage them to take the test and give them incentives to do so. So, for example, taking part in sports, in some sports, you cannot do the sports unless you come along and do a test first. So there's a lot of conversation going on, and we're very aware of the mixing that occurs amongst the university students. And so one of the hope is that when the vaccines, because now we're vaccinating 18 plus, that they will be very eager to take the vaccines, because that would also help in terms of reducing the risk of spread. When it comes to the other part of the question about, I've forgotten what the other part of the question is.
The symptoms for the Delta variant is different with Alpha and Beta, and because of that, are we missing some cases? Cases being missed, or are symptoms presenting later rather than earlier?
Yes, so we did get that question come up a few times this week, particularly from schools who have had children with headaches and some hay fever-like symptoms, like cold-like symptoms. We've gone to Public Health England, and we've been told that for now the guidance still is based on the 3 symptoms: cough, persistent cough, fever, high fever, loss of taste and smell. But I think they're keeping an eye on it. I know there was recently a publication by a professor who mentioned the risk from these new atypical symptoms, but we will let you know if we hear any more about this. And as soon as we find out anything new about changes in the symptoms, we will make sure we publish it.
Okay. The next question is around travel. The fact that unnecessary travel outside of Birmingham or coming into Birmingham isn't advised. How is that being publicized and promoted? Because not a lot of people are not aware of that.
Yes, so I looked into this in more detail, and we've taken that feedback, and we will try and do some more targeted work around the travel advice. This week, we were able to inform schools, many of whom had planned school trips outside the city, that it's strongly advised that they reduce any risk of unnecessary travel. And I think each school has begun to do that and look at their risk assessments. I think we said this last week, it can be very difficult because some people have made plans that will cost them a lot of money, or which will have major impacts on them. And the real problem we have is when people are mixing, sometimes it makes it even more difficult for us to do any contact tracing if they've gone further away from the city, because of the amount of work that's involved in trying to find out where they might have been and who they might have mixed with. So I think the Director of Public Health has said, we have to limit travel over the next couple of weeks until we come out of enhanced support, and that's based on government advice as well. And so we will continue to push that advice out and just make sure that as many people as possible can make a choice to remain in the city for, I think Justin said the other day, just simply means if you had planned to go and watch a show in London, watch it here in the city, all those things that we perhaps would have wanted to do further afield, we need to bring them here and do them locally. Thank you.
Last week, Medupa, you confirmed it was okay just to swab nostrils for the LFT test if throat was an issue. Is that the case for PCR as well?
So it should be, because for both tests, it would be the same sample, kind of sample. So it's to either blow your nose, blow really hard and get as much mucosal fluid out, and then swab for as long as you can. So, keep swabbing for a few seconds if you can, each nostril, to get as much out of it. Then that should be sufficient as well for PCR. This is what we've been told if you're unable to do the throat swab. But both throat and nose swab are the preferred.
Okay, the next question has come up quite a lot, Medupa, obviously in other calls as well, about supermarkets and how people feel that it's unfair that, they're doing their best, yet when they walk around in supermarkets, there's people there without masks. When they're spoken to shop assistants are scared to challenge their customers because of the pushback. Also, another local supermarket, it appears as if they've gone away with they used to have a one-way system, and some of the COVID safety measures, one-way system, one way in, one way out. They've kind of like abandoned that. So what are we doing as an authority about that?
That's helpful, and we will make sure that we continue to remind people that wearing face masks is part of the ways, one of the ways in which we can stop the spread of COVID. I think the face mask rule, sadly, there are quite a lot of exemptions to it. I've seen it myself because I've had to advise people recently. And the reality, just as we said earlier, is it's down to individual responsibility. I think many people perhaps were expecting that, as we were coming out of step 4 this week, that things would go back to normal. And even after the step 4, there are no guarantees that we won't still be advised to continue to wear face masks or face covering. So we can push that a bit more this week and perhaps get some of our ward elected members in the wards to continue to remind their constituents that face coverings are still highly recommended in indoor spaces. I think if we look at the way that the Far East have managed with previous pandemics, people continue to wear face coverings that come from certain parts of the world who have had similar coronavirus pandemics or more epidemics in the past. We saw that with the SARS pandemic, and they continue to wear face coverings, so I think we can learn a lot from that. But we do recognize that we're in a society where many people do have that choice and will sometimes want to exercise that choice. But our advice is for everyone to still wear face coverings when they're indoors and when they're in this communal areas, so that they can protect themselves and others. Thank you.
Okay, and the next question is, my 13-year-old wants to get a vaccination. Please consider 11 to 70-year-olds in policy making as cases increase. 3 years in academic years will be affected.
Thank you for that. And we are definitely working closely with, I think Justin's already been clear that we will be continuing to encourage everyone within the population to take up the vaccine as soon as we've got the go ahead and all the evidence that we need. So we've considered doing a vaccine toolkit similar to what we've done for the adults. We're targeted at young people and making sure we pull out all the evidence that exists, not just here in the UK, but worldwide, to be able to offer people the best evidence to make a decision. Because we recognize it's going to be a tough one for some guardians and parents, and it's important that we can give you all the information you need to make those choices. So thank you for that, and yeah, we'll make a note of that.
The next one is, are we doing anything about the anti-vax leaflets that are going through people's letterboxes?
Yeah, so that's the point I was trying to make, that we definitely recognize that, and so all the information we've been getting about leaflets and messages that are anti-vaccination, we're collating those and sharing them nationally, and the plan will be to offer people as much evidence to support them with their decision making, and continue to have these sort of sessions with you, because that's the whole idea, that we can look at these issues and go and get the answers you need to push the truth within your community. The co-op question, Habib, I was just going to point out that that's really helpful, and we're doing some work with the businesses. Actually, next week there's going to be some work with the Greater Chamber of Commerce, and we are targeting businesses with some leaflets and more information that they should be pushing to remind their customers that we still expect people to follow those rules, and for the businesses to signpost people to the one-way system and other ways to keep them safe.
Yeah, colleagues can, we'll also have a conversation with environmental health colleagues, enforcement and compliance, because they're dealing with that, so we can raise that with them as well. So there are colleagues that actually look after supermarkets. Thank you for that. The other question was, beauty establishments are not complying with masks. Are there any inspections being undertaken to enforce compliance?
Yeah, so similar to what I said about businesses, I think we've recognized and we've been told that certain businesses are not following those rules. I think with the beauty, I can't remember the details now. I think there were some rules around whether they wore the face shields or the masks. But I think generally, because it's indoors, people should wear masks, and that's the advice that we've been given. So I think, again, through the environmental health officers and through our interactions with the businesses, we will highlight some of these examples and try and push some more messages around that for both the business owners and their customers.
Colleagues can also use our whistleblowing line, or you can email if you feel there are any establishments or organizations that are actually breaching COVID compliance. I'll get that link up for you and I'll put it in the group chat. I don't see any other questions. Oh, sorry, there's a couple of more questions coming up. I'm also in support of timely spot checks on some target areas to ensure compliance, because a lot of people aren't wearing masks in open gatherings anymore. That's a comment. I reported trampoline park and they did receive a visit. Thank you very much for that feedback. So, environmental health colleagues do go out, believe it or not. I've been out a couple of times where we've had breaches or complaints of breaches, and I've actually went with environmental health officers and COVID enforcement officers and visited and had conversations with those sites. And it is pretty much, I mean, just to make it clear to yourself, we do use a 4E's approach, which is around engaging, educating, explaining, engaging, encouraging, explaining, and then enforcement is the last E if people aren't willing to comply and they're not listening. There's another question. Are there areas or towns in the UK that people living in West Midlands cannot visit?
Well, I think it's a tough one, isn't it? So the advice is, if you are living in Birmingham, because we are in enhanced support, you're not to travel unless it's absolutely necessary. I think we're the only city, isn't it, in West Midlands, as far as I'm aware. There's under enhanced support here. So I think the answer to that, Nina, is that for now, if you live in Birmingham, you're not meant to be visiting outside the city unless you absolutely need to. And that's because of the increasing Delta variant. Hopefully that will change if we can stop the spread and change the direction of travel with this infection. And that's why we're having these conversations and trying very hard to work with everybody to support people to test, to vaccinate, and to isolate.
James, don't see any more. Sorry, seeing if there's any more questions in there. Is it okay? How is it going? Recruiting young people to become COVID champions. Is there any published data re-vaccine uptake for 30 to 40-year-olds?
Yes. So with the champions, I think we definitely need your help. We have also reached out to the schools. Our contact for recruitment is the youth worker within the council, Juliet Faulkner. Please do email her. I think we should perhaps start to put Juliet's email in the COVID Champions update, Habib, so in the dashboard.
Sure.
Okay.
Yeah.
If we can add that to our, so yes, please, and we can put her email address on this chat as well. Please
I'll do that.
ask any young people who would like to be part of that program to join through Juliet. Regarding uptake for 30 to 40-year-olds, so we have on the dashboard that's published weekly and shared with you, we started to add the vaccine uptake data. So if you scroll down, it's a PDF document with about 5 slides. The 30 to 39 uptake, so first dose uptake amongst that group is just under 50%, and second dose uptake is about 20%. But I'm assuming that that's because if you think about it, the rollout has just really recently started. So hopefully that will continue to improve. The other thing about the data we've been told is sometimes the denominator used can affect the outcomes that we see in terms of the numbers. So we have to look at those numbers with a bit of caution, but we use the population on the ONS, which is about 10 years old. I think the census data was just completed. The data gathering was just completed, and they're just pulling all that together. So based on that data, it's about that. But we do know, though, that that group has only just started receiving the vaccine. So it's still early days, but we'll continue to report it. Yes, and we can put the link to the dashboard here as well, so you can see it. I can do that. I've got the link.
Okay. Then, sorry. Next question. Sorry. Can you repeat that information about the PDF? What you just said, Modupe?
Yes. So we've got on the COVID dashboard. We have got, which I've just put the link in there for everyone. We got, if you scroll down the PDF, the latest report dated 20th of June, you will see that it's there on the page 4. There's a breakdown of the vaccination uptake by age group. So that will give you an idea of who's had the vaccine, and it breaks it down to first and second dose as well.
Thank you. And I've also put the, in terms of if anybody wants to report a concern about non-compliance COVID, the link's on there, the telephone number, or you can actually email it in as well. Okay, there's no other questions. Anybody else got any other questions? Does anybody wants to voice a question? Okay. In relation to guest invite for weddings, is still 30 or one can invite as many as you like. Also, are there any rules if the wedding ceremony is held at home with a big tent?
Mm-hmm. Yeah, so the rule did change, didn't it, for guest weddings?
From the 21st, Modupe.
From the 21st, from Monday.
Yeah.
So now it says you don't have to have a limit on the guests. However, the venue, because we're still in step 3 of the roadmap, the venue capacity will still have to be taken into consideration. And so they would be able to assess how many can safely attend the wedding. I think you're not allowed to dance as well, I believe.
No.
I can't remember now. Yeah.
No,
okay.
yeah, no dancing, no singing. Table service as well. Table service as well.
Yeah. So it's got to be table. Yeah.
Because it's basically how many ever COVID safely the venue can actually cater for.
Absolutely. So these are the key rules. And I think you've mentioned having it at home with a big tent. Again, so assume the tent is outside. Is it, you've got to think about ventilation, what sort of tent? Is it one of those with the sides down or up? It's also important to think about how people will access, if it's in your home and they've got to come through the house or they have to use perhaps the toilet in the house. So, you have perhaps more people going and using a communal area in that respect, somehow indoors, So I think depending on the size of your guests and your plans, it's just important to bear in mind that COVID will spread more if there are more people within an enclosed space, and using the same sort of facilities increases the risk a lot more. And so we tend to say to venues or settings when they have an outbreak, how often do you clean high touch areas like door handles and railings and things like that? So it's important to bear that in mind. We think if you are planning a wedding, I think it might be safer not to have it at home, really, because of access to toilets and facilities, and perhaps much harder to control people meeting indoors together in large numbers.
And also, sorry, just going back to the wedding one, it's like just like how it is for indoor hospitality, 6 people per table.
Yeah.
But there's a question someone's asked: what are the incentives to attract young people to become champions? I think that's a conversation Medupi will be having with the senior youth worker. Obviously, she will have a strategy in place to look at how they can attract young people.
Yeah, and I think if Sylvia would like to help us with that, actually, I'd really explore that, perhaps, Habib.
Yeah.
Well, if Sylvia would be happy to, we can touch base with you and get some perhaps insight or ideas from you that we can share with the youth workers as well,
Sure.
because we are very keen to get more young people engaging with the program.
Yeah. Sylvia, I've put my email address in the chat. Please make contact with me and we'll have a conversation outside of this.
Thank you, Habib.
Thank you for that, Sylvia. Question: in my church, rather than being seated in separate households or bubbles, we are now allowed to have 6 from separate households seated together at a service wearing masks. Are they meant to be 2 meters apart? Not in your 6, but the separate 6s need to be 2 meters apart. So you can have 6 people together from different households in your place of worship, just like how indoor hospitality works. But just like how the next table needs to be 6 meters apart, the next group of 6, or even if it's 1 person or 2 person, needs to be 2 meters apart from yourselves.
Thank you, Habib. And I think that's what we call the rule of 6. I think generally that's sort of the name it's given.
Yeah.
And I think also what's very important about meeting in places of worship, and Habib does work very closely with the places of worship, is that many of our places of worship in the city have been encouraged to sign our COVID charter. And that's a way for us to work with them as a council to go through their risk assessments and make sure that they have put in place all the measures to keep the congregation safe. And as part of that, they get a certificate. So, all that can be displayed or, used to reassure congregants, the congregation that they are following the rules. I think ventilation is so important in places of worship. So we are encouraging them, especially now that the weather is a bit better, to make sure that, people are sitting in those groups, but also having windows and, if possible, doors open to keep the venue well ventilated.
Thank you. Someone made a comment. Can you voice? I'm not quite clear what you're saying. Amy, can you voice? It says, please note the link in the champion email to become a champion is broken. Amy, do you want to clarify that if you want to? You're on mute. Amy, go ahead.
Yes. Hi.
Hi.
Yes, the link in the email, the champion email that was sent for this meeting, there's a link in it to become a champion. And when you click on the link, it takes you to a page that isn't recognized.
Oh, thank you. Thank you for that feedback, Amy. We'll take that up with our web team, and we'll sort that out. Thank you very much. Really appreciate it.
Thank you very much.
Sure.
Someone made a comment. It doesn't seem to make sense to be relaxing restrictions like the 6s when they're in enhanced support. Hope Radio saying we're happy to give young people a show on Hope. Yep, Hope Radio, please share your details outside of the meeting. Make contact with me, and we'll put you in touch with Juliet, and then we can see if we can sort something out, even if it's promoting the fact that we're recruiting youth champions as well as adult champions as well. Thank you for that. Appreciated. Next question: why are some nursery schools and primary schools still insisting that parents bring children to their induction meetings next month? I'm assuming that's physically. Medupi?
Yeah, and the advice, we've been very clear that those what they call transition days have to be virtual. And so again, as Habib said, very, very welcome, Deborah, for you to send us a message in confidence, just to say to us which settings are doing that, because they really shouldn't be. And we've made it very clear that those days need to be virtual. And I will actually pop onto the chat as well. We developed a set of FAQs for the schools just to assure them and to help them to answer those questions. And I know some have had pressure from parents, and we've asked them to share these questions with the parents so that they can see that it's not the school that's made the decision, it's the advice from our Director of Public Health. So that's really good to know. And I'll let the schools team here in the council, I'll give them a heads up on that as well.
I mean, just following on from Madupi, I know it can be a bit challenging and it can be a bit difficult and awkward, but it is in confidence. Even if you don't want to go through the whistleblowing line, you can email myself, ourselves, and we will, on your behalf, chase that up. Because unless, obviously, we as a local authority, unless we get the intel, we really can't, not challenge, but we really can't address that issue. So we'd appreciate the feedback. And we do appreciate that it is challenging and it can be a bit awkward, particularly if it's a school that your child goes to or somebody that you know or your neighbor or whatever. But we've got to look at the wider picture. It's about protecting and safeguarding everybody. Oh, it says the link for becoming a champion has now been fixed. That was quick. Thank you, Amy.
Thank you.
Yeah, maybe it was just a web error or something, or maybe the local authority will, evening most days, they're actually fixing the web and stuff. Sometimes it does go down. Any other questions from anybody else?
You can unmute yourselves and speak as well if you want, if you'd rather say something. We'd like to hear from you.
Yes, go ahead.
Hello, it's Sunita here. Could I just say that I know that you're all saying that with the travel restrictions in and out, there are restrictions, and I know it's been said that you're going to try and do something about it, but do you not think that there should have been something on maybe Central News or Public Health announcement to say that within Birmingham we shouldn't be travelling in and out of Birmingham?
So thank you, Senator. It's a really good point, and I think when the announcement was made that we were now in enhanced support, the actual guidance went out centrally, and that was based on government advice, which travel was one. I think wastewater testing also is something that is being undertaken as part of that support. And you're right. I think what we need to do is make sure that on the ground, more and more people have access to that information and are taken on board. So we have a campaign that our corporate comms team have been leading on, the No Bull campaign. And there's actually campaign material about travel, which I've seen. Again, it's, I think, mainly been going out through social media. And our Director of Public Health has been on the radio and he's been talking about it. But I think the difficulty is always being able to reach everybody.
Yeah.
And so just today, I think we had a chat in my team about what we could do about the travel restrictions. So even the set of FAQs for the schools I put on there does talk about travel, and that's on our website as well. So I think it does get very difficult. There's so many tranches to the advice when it comes to enhanced support. There's the travel, there's the testing, there's the vaccination. There's so many bits to it that I think we need to do more, as you say, to make sure that these specific examples, especially the themes that are coming up time and time again, that we are reinforcing those messages through different channels.
Yeah,
and I mean, so yeah.
Sorry, I was just going to say.
So what I wanted to just say was that if you can't think of anywhere else that you think perhaps we need to push that message out more, because I know Justin has been on the radio, he's been on TV, and it's been the same issues, but there are quite a few things that are happening at the same time. Sometimes I think the volume of that information can mean some things get buried, but it looks like the travel is a constant recurring theme. And we've seen this with the schools as well, which is why those FAQs were produced for the schools community. I'm just wondering if you think there's anything else in particular. I think it's been going on our Healthy Brum social media pages as well.
I think that if it was on the news, maybe the central news, and be specific to the to Birmingham, maybe they would take more heed, because I said it straight away as soon as we had the last webinar, and the response I got from my group of people, and they were like, well, it's not on the news. And I said, well, I've just come out of a meeting and this is what they've advised, because they're all planning to go away for a trip. And I said, you may want to reconsider that. And the answer was, well, it hasn't actually been said on the local news, whether it's central. And then the other answer was, well, I don't live in Birmingham, I live in Sandwell. But Birmingham and Sandwell are very, very close together. So that's the response I'm getting on the ground. And I would have thought that maybe a public health announcement, even a daily one, just whilst we're in this enhanced period, so that it's just, reiterated to them, to everybody, that we are in this process. We don't expect you to travel, and can you please amend your travel arrangements accordingly. And obviously other people have they had booked trips and they'd paid for them, and they said, well, we've paid for it, we're not going to get a refund, therefore we're still going to go.
I think this is the challenge. I mean, even now I've just seen an ITV news, I've just popped it the link, where if you look at that, it talks specifically about Birmingham, and it talks about the new advice on travel and socializing, and but I think you've hit the nail on the head. A lot of people are weighing up the investment they've made to go away and feel that they cannot make that sacrifice. And it's sad, because these are the things that continue to limit our ability to stop the spread of COVID-19. Sandwell itself, and you're right, it's really close, but because it's not one of those cities under the enhanced support, it may be that people there are able to move around, but they shouldn't be coming into Birmingham. It's the advice we would give them as well. So it's almost, if you remember when we had the tier system, if you remember, it was all very confusing, because I remember I had to go and see my auntie, and I had to look at what tier she was in to decide whether I could go in or not. And I think we're at that period again where it's also confusing, and because the announcements came so close to the moving to step 4, and people I think had already been looking forward to, we made a lot of plans, didn't we? I'm not making an excuse at all. I mean, it's not the reason why we then can't adapt to this for the next few weeks and make these sacrifices to get the city out of this state, so that we can all enjoy our freedoms. So what it will do is, your suggestion that we push this every day, I think between tomorrow and Monday, our comms team will see what we can do to do some targeted awareness around travel. Because just this afternoon, actually, I had a chat with our comms lead about this, and what would help us as well, because we thought we could give some examples and take people in the community who have made sacrifices regarding travel as a result of enhanced support. If there are any examples that you have, or if any of you, if you're willing to come out and speak to us and perhaps do a couple of videos or speak about the sacrifices you've made and tell your story, I think it would really be impactful. So that's an offer that we're putting out. So please do come back to us if you can. And I think over the next week or so, we will try and push out the messages about traveling and, the sacrifices we're all making to stop the spread by staying in the city over the next few weeks.
We've probably got some.
Yeah, go on, Hope, and then there's 2 more questions. I'm just conscious of time. Hope, go ahead, please, and then we've got 2 more questions. Hope.
Yeah, I was just saying that we've got some pre-recorded content of loads and loads of interviews that we've done with people. So we can probably share some content of stories and things like that. Also, I was wondering, although you're reaching out to the community and your comms team is doing a great job, is it, as a journalist myself, is it worth reaching out to the journalist community and the student journalist community and trying to recruit them as community champions. Because if they can come to these meetings, then, do you know what I mean? They've got the word from the horse's mouth. Journalists are generally lazy. So, do you know what I mean? If you get, sorry, we are. News is constantly moving and moving and moving. So, do you know what I mean? If they can come here, record this, if these are available, then they can put them out. They've already got the content. Do you know what I mean? It's about, we're working with a very limited team. I'm not trying to defend the broadcasting or the communications industry, but we're all working with very small teams, as you can imagine. We're all working remotely. Midlands News is West, you know what I mean? It used to be Central News, and now it's the hot, because you know, people are losing their jobs in our industry. So we're trying, defending the broadcasting industry as key workers. We're trying our best.
Thank you for that.
Absolutely. That is so reassuring. And thank you so much for those fantastic ideas. Hope Radio, watch out. We'll be coming to find you, I think. Habib and I will make sure that we really take you up on those fantastic offers. Thank you.
Last question, Modupe, and apologies, colleagues, if anybody question isn't answered, we'll take those questions and we'll bring them back to you or email the answers to you. Last one, and it's a really good question. This is pertinent. What factors will enable Birmingham to come out of enhanced support?
Well, those things we mentioned, you know, our rates of infection in the Delta variant, we just need to bring it down below 100 cases per 100,000. We need to get more people vaccinated across the city. I think the target, if I remember, Justin was saying about 80% across all the wards. So what we have is, although across the city it's gone up, but there are wards where it's really, really negligible. And we really want to take the vans out and see more people coming out and offering themselves up for vaccination. And I think it would really help us to understand from those of you who perhaps live in the west of the city, for example, why you think, you know, people there may not be taking the vaccine as much, because we've recognized that those are the areas that sometimes people are more reluctant to take the vaccines. I think at this stage, as I mentioned, it's been a while now, so more people are feeling more confident, but still we have loads of people within the community who need a bit more support and a bit more information to make the choice. This Delta variant is very, very tricky. And I think until we vaccinated as many people as possible, we don't feel that we can rest or minimize the amount of effort we're putting into meeting with you and encouraging you and working alongside you. So from our perspective, you know, we can only reverse this when the rates have gone down well enough and when more people have taken the vaccine. And I think we owe it to the younger generation as well with this Delta variant, because, you know, they're the ones who perhaps are least likely to understand the severity. And I'm not saying this flippantly. I know lots of young people are extremely clever and, you know, are able to make decisions. I think for their generation, it's a bit different, because the older generation might feel we've lived our lives. I think we owe it to this generation, because their futures and the way the last year has been for them, their futures are greatly affected by how this pandemic ends. And so we really need to stop the spread of this virus so that we can go back to some kind of normal soon.
Okay, thank you very much, colleagues. Thank you for joining this evening's webinar. The next webinar will be a fortnight's time, unless we need to meet earlier if it's an emergency or whatever, then we'll obviously invite you guys. Do try and join. The next one will be actually a Wednesday. It'll be a fortnight's time on a Wednesday rather than being on a Thursday. We'll try and keep the time the same. The 6 o'clock seems to work for everybody. That's it really from me. Modupe, is there anything that you'd want to add?
I just wanted to say, someone's directly contacted me about being concerned about attending events. And I think, you know, if it doesn't feel right, then please don't go, is what we've been saying. I think, you know, what we want is for the future to be such that we can go back to attending events and mingling and mixing and doing all the things we enjoy. And these sacrifices we make now are going to help us in the future. So I think what I would say to everyone is, you know, we don't want to be a fall out and enjoy the good weather, but at the same time, let's do it responsibly, hand, face, space. And if you haven't had the vaccine yourself as a champion, or if you have family who are hesitant about having a vaccine, please encourage them to come to these discussions with their concerns, and we can talk about it, and also encourage them to speak to a trusted professional about their concerns. The good news is the vaccines are working, so we have a light out of the tunnel, and I think we just need to really take advantage of that and make the sacrifices now so we can have a better future for all of us and younger folk as well. So thank you all. Thank you so much, Habib and Said, because I know this is beyond our normal hours. We appreciate everybody's sacrifices.
No.
Yeah, absolutely.
If champions can make the sacrifice, we can. Anyway, take care, everybody. Colleagues, stay safe.
Thank you so much.
Okay,
Thank you, everybody. Stay safe. See
Bye-bye.
you all soon. Bye-bye.
Bye.